So we've done a scope and review about looking at how paramedics are working in primary care roles across the UK, and looking at a variety of evidence. We found that there's a real difference in title under which paramedics are working. So they may be called paramedics, community paramedics, advanced paramedics, first contact practitioners, but none of which actually tells you what they do. Something else we found is there's a lot of variation in the clinical activities that they undertake. So some purely undertake what you would consider the traditional paramedic skill set and some paramedics are doing more complex procedures that you would think were particularly in the remit of general practitioners. We've also found that the paramedic that you see, for example in Northumberland, is different to the paramedic that you see in Oxford in terms of their scope of practice and in terms of their competency. So there's a real lack of standardisation, and with that lack of standardisation there's also changes in how paramedics are being supervised. So there's no standardisation in terms of reporting or supervision for paramedics. So some might be really well supported within their GP practices by the GPs, but others will receive no supervision, no feedback, and this is quite worrying because this lack of standardisation, the lack of standard title, the lack of scope of practice means that the patient doesn't know what they're going to see. So you should have an expectation that the paramedic that you see in Oxford should be the same as what you see in Northumberland, and the literature at the moment indicates that that's not happening. So we definitely need to do some more research to scope out what's actually happening in practices across the UK, and then look at maybe what is needed to help that standardisation, whether that is an education curriculum or training or something different, and that would be the next phase of our research.